Good morning. Welcome to Prince George's for all the residents that are going to be coming to join us here. So here, this is our Pisces, which is our EMR here. It's also Optum or ED Pulse Check. So when you look at it on the desktop or if you're going through the intranet in order to find it, that are some of the names that it can go by. So after you kind of click on the desktop and you open up the application, you put in your username and password, and it's going to take you to here. This is kind of your general mainframe of where you're going to get everything. So here we can see the bed number, and that will kind of be in just basically a normal order. If you want to go through the display, you can ask one of your attendings on how to do that and how to change your display based on where you're working, maybe in fast track or in the main side of the ER. These are going to be color coded based on their urgency or their ESI level. Here you'll see the patient's name, their age, their chief complaint. So a lot of times this is what's put in by registration, so not always 100% accurate. This will be the attending that's assigned, the resident that's assigned, so you click on that to get put your name on the patient. This is any kind of extender, so physician extenders, PAs, NPs, the nurse, any other type of RN extender, the primary care doctor. So this will be a primary care doctor. Sometimes if you admit the patient, then that will show up as that admitting physician. Orders that are placed, you'll see some blue, which means that they've been looked at, they've been acknowledged, but they haven't been done yet. Red means they have not been acknowledged yet. Green means pretty much they're good to go. And a lot of times you'll see orange as well, which means that it's been received, maybe received by the lab, received by radiology, but just not done yet. X's are radiology, L's are labs. And it's nursing orders, and this little A is an admission request. So you'll also see things over here, some of these letters, numbers, really not important, but especially this number here, which is kind of how well your documentation looks. And we'll talk about the scoring of the documentation in just a little bit, but that's going to be really important as well. So let's sign up for our patient. So say we wanted to sign up for glucose stabilizer patient here. I am an attending, so I am going to click the attending spot here, and I'm going to right click in that area right there. And so right when I right click, now that kind of times when I've seen the patient, and so I would just click enter, and now I am signed up for that patient right here, and I'm the attending on record. If you were the resident, then you'd sign up for the resident spot, and that will be very similar, or physician